here again this week. Let's go ahead and get everything up and loaded, and then we'll get started. I have a new subject to talk about today, as always. And I think this one is a subject that many kind of overlook. Okay. So, I really wanted to bring it up and see what you thought about it, see if you have any questions about it. And we'll get started in just a second. Want to make sure that Rumble's up and going. Good morning to everybody, and good afternoon, good evening, whatever your time zone is, on Cloud Hub and Rumble, and those on replay listening to this. And I hope you do share this with people because that's the idea of having this is that it will be shared and people will get a benefit out of this. And a lot of times, again, we don't have time to go and do the research ourselves. And so this is a way for me to help you, get that information to you and to others. So let me know if you are seeing this and everything is up and going. Looks like the on Rumble today, it looks like the video is not very good, not very clear. Don't know why that is, but who knows? We'll just go anyway. That's what we'll do. All right. So let's go ahead and get started with this. And again, if there are any questions afterwards, just let me know. And here we go. All right. Today we're going to talk about our teeth. How much should I care about my teeth when it comes to my overall health? Good question. According to the fossil record, ancient humans usually had straight teeth complete with wisdom teeth. In fact, the dental dilemmas that fuel the demand for braces and wisdom teeth extractions today appear to be recent developments. So, what happened? While it's nearly impossible to know for sure, scientists have a hypothesis. Travel back to a time when pearly whites and jaws had to chew, chew, chew so that foods were digestible, then compare that time with contemporary eating habits that often include softer, processed foods. So our changed when our eating habits changed, but are they important to our health today? Our oral health is connected to our overall health. What are 5 oral health diseases? Common oral diseases and conditions include tooth decay, which can lead to broken teeth and tooth loss. Gingivitis or gum disease is inflammation caused by a buildup of plaque. Periodontal disease is a more serious gum disease caused by untreated gingivitis. The infection can spread to the jaw and bones and lead to an inflammatory response in the body. Sensitive teeth or discomfort caused by hot or cold foods and beverages, and it can be a result of thin enamel, reaching gums, or other factors. And there's also oral cancer, a diagnosis that affects 50,000 Americans each year. Tobacco use is the most common risk factor for this disease. Now, what are the signs of poor oral hygiene? Signs of poor oral care habits and hygiene can include toothache, gum disease, including gingivitis and periodontitis, I guess, I should say, receding gums and sores in the mouth. Bad breath, sensitivity to hot and cold foods, dry mouth and teeth, and any other conditions that create discomfort and health issues. Now, what types of medical conditions can be spotted through your teeth? Heart disease is one of them. Many patients with heart disease are also diagnosed with gum disease. If you have been diagnosed with periodontal disease, you are at higher risk for gum-borne bacteria being able to enter the bloodstream and flow into your heart. If you have a family history of cardiovascular disease, you want to let your dentist know so that they can better monitor the condition of your teeth and gums. If you have coronary artery disease, the last thing you need is dental plaque traveling through your arteries. Diabetes. People with diabetes are often vulnerable to infection, which is why they may have gum disease. Gum disease is caused by untreated plaque buildup on your teeth and gums and can develop into the more serious periodontal disease. While gingivitis can be reversed by adopting a healthy oral hygiene routine and having teeth preventively clean, periodontitis is a lifelong condition. If you have a family history of diabetes, you'll want to let your dentist know so that you can easily spot gum disease symptoms like bleeding gums, receding gums, swollen gums, bad breath, and tooth loss. Osteoporosis. As we get older, the bones in our body may weaken from what is called osteoporosis. It's a condition that causes your bones to get brittle, which is why many elderly people may break a bone after a slip and fall. Your dentist may be able to spot the signs of osteoporosis in your smile, which includes loose teeth and receding gums caused by tissue loss. Oral cancer. The American Cancer Society estimates over 50,000 Americans will get oral or throat cancer by the end of the year. Thankfully, oral cancer screenings are designed to catch oral cancer in its early stages, so you have the best chance of survival. You are at a higher risk for getting mouth cancer if you have a history of using tobacco products or abusing alcohol, which is why it's important you fill out an accurate medical history for your dentist. During your routine dental exam, your dentist will be able to do an oral cancer screening and check the inside of your mouth for suspicious patches or lumps. Eating disorders. While people with eating disorders are obviously aware of their actions, they may hide their symptoms from family members and medical professionals. Unfortunately, this means that many people with eating disorders don't get the help that they need. During a dentist appointment, a dentist should be able to catch the signs of an eating disorder by the loss of tooth enamel or the insides of front teeth. A person with an eating disorder may also experience sensitive teeth, bleeding gums, and dry mouth. Dementia. One of the early signs of dementia is poor oral hygiene, as people often forget whether or not they brush their teeth. Turns out that poor dental hygiene might actually increase your risk of dementia to begin with. Scientists now think that the bacteria that causes gum disease might be able to travel to the brain and cause cognitive impairments in elderly patients. A recent analysis led by the National Institute on Aging scientists suggests that bacteria associated with periodontal disease that causes the chronic inflammation are also associated with the development of Alzheimer's disease and related dementias, especially vascular dementia. Kidney disease. When your kidneys aren't working properly, the effects can be felt throughout the body. One of the symptoms of kidney disease is foul or sweet smelling breath, sometimes accompanied by dry mouth. If you notice any of these symptoms, it's important to talk to your doctor or your dentist about a possible diagnosis. In summary, gum disease in particular has been linked to heart disease, diabetes, respiratory ailments, and even Alzheimer's disease. So, what should I do to improve my oral care? Well, there are some things that we can do, such as brush your teeth regularly with a soft bristle toothbrush, use a fluoride toothpaste. We'll talk a little bit more about that in a moment. Rinse and gargle with an antiseptic mouthwash, regular flossing, see a dentist regularly to get a checkup and cleaning, and pay attention to oral pain and other warning signs. So, are all toothpaste the same? Should my toothpaste contain fluoride? It depends upon who you listen to. What is fluoride? Let's take a look at that. Fluoride is a trace mineral naturally found in small amounts in a variety of foods. It is most recognized for its role in preventing and reversing dental caries and building strong teeth and bones. Most fluoride is absorbed in the gut and stored in bones and teeth. Unabsorbed fluoride is excreted in urine. Children absorb fluoride more efficiently than adults as their teeth and bones are rapidly forming. So, if you have some questions about whether or not fluoride is the best thing that you can use, that should be a little bit concerning to you. Now, the tolerable upper intake level for fluoride for all adults, 19 plus years of age and pregnant and lactating women, is 10 milligrams daily. A UL is a maximum daily intake, unlikely to cause harmful effects on the health. Now, that's for adults, not for children. Let's look at what 7 side effects of consuming fluoride are that you should know about. Number 1, tooth discoloration, tooth decay, skeletal weakness, neurological problems, high blood pressure, acne, and seizures. Now, special note to me were the neurological problems supposedly caused by fluoride. Said that fluoride not only affects bone and teeth, but it also impacts young children in the development of the brain. Exposure to fluoride before birth could lead to poor cognitive outcomes in the future. Higher levels of fluoride lead to low scores in IQ tests, according to the research that I found. Now, if you're concerned about fluoride, which I'm one of those people that are, I think the less the better. I even have a water filtration system that supposedly takes out the fluoride that they put in the water. There are toothpaste and mouthwashes without fluoride in them. One is Spry, Tom's is another one, and Burt's Bees. Now, there are plenty more. Those are just 3 that off the top of my head that I knew about. And as for my water filtration system, I use Alexa Pure Pro, and we've talked about it a number of times here on the show about what that does and what I feel. I've been using for several years now, and I love it. Now, some doctors believe that your toothpaste should also contain, instead of fluoride, hydroxyapatite. Hydroxyapatite, also hydroxyl apatite, is a naturally occurring form phosphate calcium mineral. And this mineral has good biocompatibility. This means that it's highly compatible with living tissues. For that reason, hydroxyapatite is an ideal ingredient for bone and teeth replacement and repair. Now, which toothpaste contain the hydroxyapatite? There's just this that I found in a quick search on Amazon. I'm sure there are more. I've seen Marvis. I haven't used it. I may start using it in the future. I'm going to check into it a little bit more. But I noticed that was ranked as one of the, the kind of the best toothpaste overall, which didn't have fluoride in it and also has the hydroxyapatite. So as I said, there are many other toothpaste without fluoride and those with hydroxyapatite. So happy searching, and here is to your healthy smile. I hope all of this information helped you and helps you to know how important your health of your teeth and gums really are to your overall health. The more we go into this and the more we look at everybody's sort of individual health and wellness journey and me looking at my own health and wellness journey, it's amazing how things that you never thought about before have such an impact and can be a major impact on your health. And yet we don't really talk about it. We have, for example, the fluoride. They put fluoride, a lot of states, in the water, and who knows what levels they put in there. People a lot of times don't even know that there's fluoride in their water. The again, the neurological aspects of it on a child was very concerning to me, and on their cognitive development, their IQs. Uh, wow, I mean, why are we even using fluoride? If that be the case. Um, so it seems like the more that we can do to not use it, to find alternatives like the hydroxyapatite and other things, like using a water filtration system that gets the fluoride out of it as best that they can, would be the ideal thing to do. And all of that has an impact on your health. And, your teeth apparently, have a great impact on how you care for your teeth, has a great impact on a number of different things, including your heart. So it seems that we can't take anything for granted, and we just have to keep learning and keep shifting when we do find out that things aren't necessarily good for us that maybe we've been using since childhood. I mean, I think that it's probably never too late, to make that change if it's needed, and to have a better life, even, despite whatever age you are. The younger, the better that you make those changes, I believe. But the older, it also matters because you could improve the quality of life and perhaps even the number of years of life that you have left. So I think, again, it's important for us to do our research. It's important to find out everything that we need to know about little individual parts that, like our teeth, that we never really thought about and maybe have taken for granted. And it seems like a lot of that, for children especially, as they grow, what you're putting into their bodies, what you're putting in doing with their teeth, are going to be paramount in their health and wellness. And I mean, we could get into the number of shots that they take. Uh, that I mean, I can't even imagine giving a child that many shots. So, you know, if your teeth, as minimal as that is in some areas, as compared to the number of shots that young kids are getting, what are the shots doing? Okay, and I think that's something that we always have to continually ask. But that's for another show, probably. So, does anybody have any questions? That's all I really wanted to present today. We'll have another topic again next week. And, we'll just keep building upon our health and wellness journey. And again, it's important, I think, that if you share the information, other people who may not have given that any thought, especially like about their teeth, maybe they are having some issues that could be attributable to the how their teeth are, what shape their teeth are in, the condition of their teeth. So that's one other aspect that they can talk to their dentist about and to their doctor about. Thank you, Curtis. Curtis said, good show. I'm glad that you liked it. Um, again, some of these issues I bring to you, and I'm thinking, gosh, is somebody going to care about this particular issue? Because it's not something that is glamorous, right? It's something about your teeth. Nobody really wants to talk about that. But I think it's just essential in the fact that, for our health, we have to look at almost like every aspect to see if there are some things that we can control. Some things we're not going to be able to control. Like they said with periodontal disease, you really can't do anything about that. Hey, Cheryl, thank you for all research you do. I share with everyone. Thank you, Cheryl. I really appreciate that. A real eye opener. I know, isn't it, Curtis? I mean, the more I get into it, and to be honest with you, I never even heard of the hydroxyapatite. Uh, I didn't know that hydroxyapatite was sort of a better solution and to help your teeth than fluoride, and it's a good substitute, if you will, for those people who think, well, if I don't have fluoride, how are my teeth going to stay strong? Well, look into and do research on the hydroxyapatite and see if that's something that works for you. I know with the mouthwash that I use and the toothpaste that I use, I don't use any with fluoride. I've totally taken that out. Haven't noticed a difference in my teeth getting worse, or the dentist saying, "Oh my gosh, what have you done? Something different." nothing like that at all. So, um, you try it for yourself. Talk to your dentist about it. Hopefully, your dentist knows about hydroxyapatite. Depends on the dentist that you go to as well. I remember under one insurance that we had a little while back. It was a horrible dental insurance, and the dentist that I had, um, I guess he was a dentist. He said he was a dentist, right? I'm not sure these days, but he was really pushing the fluoride, and there were things that he didn't spot that I had going on and on a particular tooth. He kept telling me I kept having pain. He kept telling me, "Oh no, no, there's nothing wrong. It's just the apples that you're eating." I mean, turns out there was a problem. I went to another dentist. It got fixed. So, your dentist, it doesn't know everything. And so again, it's so imperative that you do your own research, and you may have to look for another dentist, one that you feel is more knowledgeable about the area of dentistry, that can help you. Barely pass is still pass. I know, Curtis. It's amazing. So, are there any questions that anybody has before we get going? If not, again, we'll have another topic next week. And if there are any topics that you can think of that you want that I'm not talking about, that you're like, gosh, I just want to hear about this. We have viewers that do tend to give us some topics, ideas, and then I go and do research on that because I do want to have things that you want to hear about. You can either drop them here in the comment section, or you can always reach me. I don't know, there's my Etsy shop. You can certainly reach me in my Etsy shop. Just send me a message there. And that way I can get it, and I can do some research on that and bring you some topics that are just like burning questions that you may have about your particular topic. All right. Again, thank you so much. Thank you so much for joining. Thank you for coming in and looking at the replays and passing this along to everybody. I appreciate you. And until next week, God bless you, and we'll see you then. Take care.